Hey guys, welcome to another Lifestyle of Eden podcast. I'm your host, Nick Tognietti. And today I want to discuss a very hot topic in regards to functional medicine versus conventional medicine. And there's a couple different perspectives or angles from which I want to discuss this because it's okay in regards to what, Nick? Exactly. So, in regards to being a coach and how to practice, or in regards to a client and who you should see, or so there's multiple ways you can go about this. So, I have a few different ways. I have three different ways. And the first one is what I consider the functional conventional gap. That's what I want to discuss first. And this first point is really more for coaches, practitioners, dietitians, doctors, nurse practitioners, endocrinologists, things of that nature. So you have to understand as a coach, there's two types of clients, right? And as a client or as an individual, a layperson, you're one of two people. Okay. So this conversation really relates to everybody. But for coaches, you have two types of clients. You have the client that gives the middle finger to the doctor and says, F you, I'm going to do whatever Nick says. You pissed me off. You screwed me over. You never fixed my disease. You never even told me I had Hashimoto's or prediabetes or anything. You can go screw yourself. That's one client. And that's a lot of people, quite frankly. And that's a lot of coaches. That's a lot of coaches. That's like, hey, screw the medical field completely and entirely. And then you have the other client who signs up with you and says, hey, Nick, I want to get into your program, but nothing you say or do can go against what my doctor says. My doctor is still the end all be all. They still know everything. But from a daily basis and all these other things, nutrition, all that, I want to work with you. And it's okay. I have to now be careful with you on how I word things. Right. And so I'm going to give you an example with this. A good example, let's call it prostate. That's a good example right here. So let's just say somebody comes to me with prostate and they're still very conventionally obsessed. So whatever the doctor says goes, blah, blah, blah. So if I come to that client and I tell them, hey, so prostate is an estrogen receptor. Notice what I said, not estrogen. I said estrogen receptor driven issue. They're going to go to their doctor and say, hey, my functional practitioner, Nick, said this. And that doctor is going to say he's completely wrong. Conventionally, we do not agree with that at all. Prostate is a DHT, dihydrotestosterone driven issue. So now what is that client going to do? They're going to say, Nick, I don't really trust you anymore. What you said goes against what my doctor says, and this, that, and the other. So what I teach my mentees and my coaches and what I have in my university coming out is I teach you every perspective of the conventional medicine world. That way you make sure that you address that and you say, hey, so-and-so, I wanted to tell you, conventionally, this is generally blamed as a DHT-driven issue. And they're not wrong. Can DHT cause prostate issues? Absolutely. Just like it causes PCOS in women, it can cause prostate issues in men. But let's just be honest. Let's just get real granular with the statistics here. Let's cut the crap. Listen, out of every 5 prostate cases that I get, one of them is DHT. That's it. Let's cut the crap out. There's a reason why you still don't get results with your doctor on your prostate issues. Or you got your prostate removed, but guess what? You still have the problem going on. Because only about 1 in 5 of those people have that. I can prove this lab after lab. Like people with prostate, and I'll get a Dutch test from them, and they have no DHT issue at all. In fact, they have no testosterone in their body. They're low on testosterone. It's like, okay, yeah, let's cut the crap here. But why do I say this? It's important as a practitioner to explain both sides so that if I say, hey, so conventionally they say it's this, but I also want to bring to you the other perspective of what this is a lot of times that is not getting caught, and it's why it's not getting fixed, and it's this. That way, when they go to their doctor and their doctor tells them, oh, it's DHT driven, they go, oh, you know what? Nick already said that. Okay, good. At least Nick knows that aspect. I feel really safe with him. I feel like he's covering this from every angle. And they're also not going to feel that I'm speaking against their doctor, because you have to understand they still are, they're one of those two clients that will hold their doctor's word over you. So as long as they know, hey, Nick's not speaking against my doctor, he's speaking in connection with my doctor, but he's also saying we have to look at this as well. Okay, great. They are very comfortable. So that's why I say there's a conventional functional gap. Is functional connects all the dots and gets to the root of it and doesn't just look at one point, but it doesn't neglect the conventional diagnostic of that. I say this all the time with things where the conventional world has gone before us and done a lot of good work. God forbid that we throw out everything they've ever done. That's stupid. They've done incredible groundwork for us to figure out a lot of stuff, but it's not the end all be all. And at the end of the day, it's not what's going to reverse your disease. This is where functional comes in. So don't throw out conventional. That's stupid. That's throwing the baby out with the bathwater. Do not throw the baby out with the bathwater. Learn how to chew the meat and spit out the bones and say, okay, great. They said it's this issue, but how do I recognize that's not the full picture and I get to the full picture? So I actually utilize a lot of conventional approaches in a functional way. So for example, if somebody comes to me with mold, I have an app that doctors have, and you can, and actually one of the MDs that I work with actually is the one that got me to have this app. And you can type in any diagnoses, any medication, any illness, whatever, and you can learn the dosages that medical doctors will use or the approach they'll use. So for example, if I go into this app and I type in mold, what is it going to say? What's the prescription that they're going to give you? They're going to give you an antifungal because mold is a type of fungus. So then I can go functionally, oh, I don't need you to go take a medication that is going to have collateral damage. Why don't I just give you antifungal herbs? So you see how I'm actually utilizing the conventional direction in a functional way. And so I tell people this all the time. You've got to know conventionally how they're going to treat something or what they say is the root of this issue or the reason for it. Because then that way you not only comfort the client that says, hey, F the medical field, I want only what Nick has to say. Okay, great. I already know you're going to do whatever I say anyway. But you also comfort the client that is still humping the leg, if you will, of the conventional medicine space, which I'm not saying is bad or good. I'm just saying you have one or two clients and you need to learn how to relate to both. So I think that's a really good gap to be able to understand. And then as a coach, not to be like, hey, screw the medical field. No, I don't want to say that. I learn a lot from them. I learn a lot. People wonder why I've learned so much. It's because I'm willing to humble myself and learn in the places that you think are totally wrong. I chew the meat and spit out the bones better than you. That's the reality. I take the baby with and I throw out the bathwater, but I extract the baby better than you. That's just all the fact is. It just is what it is. So I think that's an important part that we have to understand there. So the next question is, does a functional practitioner replace a doctor or a specialist? And in order to answer that, I think we have to answer the third question I have. We have to go the role of a doctor or the role of the medical field. The role of the medical field, let me tell you something. I am never going to a doctor for my general health. You've lost your freaking mind. And if it is a doctor that I'm going to for my general health, it's one of the doctors that I work with, which means they practice in the way that I believe one should practice, which is functional and natural and according to my 7 pillars, first and foremost, and then can move on to other things. But like generally speaking, you're not going to see me go to a freaking doctor's office for what are they going to teach me? I don't mean that arrogantly, but what are they going to teach me? Nothing. Thank you. You can take your medications that you want to constantly throw people. Am I against medications? No, I teach that in my practice and my university. I'm not against medications. I don't agree with people living on medications. Medications are a band-aid while you fix the root cause. Once you fix the root, you come off the medication. So does that mean medication has its place? Absolutely. I went on a thyroid medication whenever I was dealing with all of my crap. Why? Because my thyroid was tanking and I needed to go on it temporarily while I fixed the root causes. Once I fixed that, boom, you taper off the medication. I'm not against medication. I'm against how they're used. But I'm never going to a doctor for my general health. Like, hey, I want to reverse this disease. I want to prevent this disease. I want to reverse my chronic illness and my sleep issues. I want to reverse my chronic inflammation and gut issues. I am getting repetitive allergic reactions. And I'm not going to a doctor for that. Sorry, not going to happen. Like, you have blood sugar and diabetes. No, not going to a doctor. Sorry. Once again, you're having some prostate issues. For me personally, nope, not going to a doctor. Sorry. Like I said, one of the doctors I work with, okay, because they're going to do it in the way that I agree with, and they're really just going to counsel me in the ways that I already know or and whatnot. But like from a hospital perspective or a general doctor, no, sorry. But listen, if God forbid I needed a liver transplant or I broke my arm or I had a heart attack, which by the way could be prevented in a way that a functional coach would do anyway. But if I have that, guess what? Don't call me. Go to the emergency room, get a cataract cath, and then call me afterwards so that we can prevent it from happening again. But so when people say the medical world serves no use or whatever, I'm like, that's dumb. That's literally stupid. If you're gonna have a baby, could I learn how to deliver a baby? Probably. I know a lot of people that do them at home, but I'm gonna be honest with you, don't call me for that. Like, you need a liver transplant or you need a kidney transplant, hey, don't call me for that. After you get these new kidneys, call me so that I can address your adrenals that caused them to be messed up in the first place with your blood pressure. You need to go to the hospital for that. You need to go to a doctor for that. There are certain things where I go, dude, you need to go to a doctor. But those are emergency cases. None of this is chronic. All of the cases to go to a hospital or a doctor are for acute illness, not for chronic prevention or reversal. Not for chronic prevention or reversal. Acute and acute only. So they have their place. But like I said, for me, I put them in their place in my life. And I recommend the place that they should be simply as a counsel to clients and to other people as well. So that is what I believe with that. Which brings me to my next point. Does a functional practitioner replace a doctor or a specialist? No, because if they're doing their jobs right, they're not doing the same thing in any way, shape, or form. So for example, a doctor, don't go to a doctor if you're trying to reverse your fertility issues. Go to a functional practitioner like me who knows what they're doing in order to reverse your fertility issues. I'm not just going to give you Femara to induce ovulation and call it a day and give you progesterone. No, I'm going to fix your adrenal issues. I'm going to fix your prostate so that your sperm is fertile. I'm going to fix all of these other concepts that you need to fix. So don't go to me and your doctor for that, because I'm actually going to fix the problem. They're not. They're going to get in my way. That's my opinion, right? Obviously, you can go to your doctor. This is not me telling me to leave your doctor to get off medication. This is no individual advice or medical advice. This is my opinion on these things, right? And so if you like a severe acute issue, I'll give you an example. There was one client of mine who was having radical pain, and I said, this sounds like pancreatitis or something along those lines. We found out she had a stone. That is not something that I could literally take care of right there. So I sent her to an ER who is ran by a doctor that I personally work with. And he practices like I do. I texted his cell phone. I said, hey, are you at the hospital? He goes, yeah. I said, I'm sending a client in right now. So he did that. Guess what? There was an antibiotic that she could take to press that out. Boom, no more pain, good to go. So you see how I exercised the emergency use of a doctor in the emergency room in that moment with something that really needed quick relief. Great. Same thing with a specialist. Here's the thing about a specialist, because I work with multiple of them. Like, they're a nephrologist, they specialize in kidney, or a hepatologist, a GI, they specialize in liver, right? A GI, by the way, does specialize in liver. It's not just GI. So that's why I say that. And a hepatologist, HEPA for your liver and so forth. A specialist does not really do super well in understanding the root causes of bodily systems. I'll give you an example. There's a liver specialist that I personally know, and we were talking about certain concepts with T4 to T3 conversion with thyroid and how influencing the liver is on that. And when I was talking about it, he goes, Nick, I'm going to be honest with you, dude. I'm not the right guy to talk about this. He goes, I've totally forgotten about all this stuff, and I've never really studied it deeply. He goes, I know it's connected, but he goes, I just don't really know. He goes, I know like more about liver transplant stuff and whatnot. But like when it came to root causes of these different types of things, he doesn't know that. Same thing with a thyroid specialist. That thyroid specialist is going to be like, oh, your T3 is low, so I need to be a specialist and give you T3, not T4 and T3. It's okay, great. But what's the root of their lack of T3 conversion? Oh, it's the fact that their adrenals are off, and therefore functionally, I'm looking at all the systems as one. There's 12 types of medicine, right? I look at all 12 types as one. So does it mean that the specialist is dumb and doesn't know what he's doing? No, but they have their place. And in my opinion, whether it's a doctor or a specialist of some sort, it needs to also be worked with alongside a very good functional practitioner that's going to take the understanding of where the liver specialist says the liver is in that moment, but connected at the root cause level that the functional practitioner is going to bring. So to me, it's not about either or. It's just about everything having its place. And if you're going to find a practitioner, find one that you're going to submit to and listen to. Don't get one who you're just going to constantly argue with. Otherwise, don't hire them. I actually just had somebody hire me for fertility the other day, and I told she and her husband on the call, I was very blunt. I'm like, hey, you know what? I don't mean any disrespect, but I'm going to be honest with you. You have a lot of cooks in the kitchen. You've got this doctor and this doctor. I'm going to be honest with you. I would rather you just go fully listen to that doctor if you're going to have them and me and blah, blah, blah. Or if you're going to hire me, listen to me. But don't mix four cooks in a small kitchen. If you're coming to me, listen to me. Otherwise, please don't waste my time and sign up with me. I have other people that will take your spot that will definitely listen to me. And my roster is way too big to have people that are just going to waste my time. Your money means nothing to me, to be honest with you, especially when there's people lining up at the door who are genuinely needing me and that will listen to me. So they said, no, Nick, we trust you. We're willing to do whatever you say. We'll go all in. I'm like, okay, great. You can sign up with me. Otherwise, like I said, like with all due respect, I love you guys. I wish you the best. And I don't think you're wrong for going and choosing your doctor over me if you do that. What I'm saying is whoever you choose, really choose that person. Like really go all in on that concept. Otherwise, if you want the best results with your doctor, do what your doctor says. If you want your best results with me, do what I say. But whoever you're going with, just go all in. And so I think that we have to learn how to chew the meat and spit out the bones and learn that it's not an either or, but an and also. As long as we understand that everything has its place, there is a time and a season for everything under the sun, Ecclesiastes 3 says. So there's a time for doctors, and then there's a time for functional practitioners. There's a time for a specialist, and there's a time for an emergency room. There's a time for antibiotics, maybe, and there's a time for antimicrobial herbs. I notice more times than not, it's the more functional, natural, seven pillars approach, but it doesn't mean at the complete and utter exclusion of those other things. So I think that you need to find a functional practitioner. I think that from a general perspective, that's the best route you can go. But if it's a good functional practitioner like myself, I will tell you when it's really time to bring in a certain doctor or medical professional in any given area, whether that's a nurse practitioner here or a specialist here or the ER here, like I told you with that woman with that acute case that we had to fix up. If it's a really good functional practitioner, hopefully that functional practitioner not only has the knowledge of when to send you and where to send you. Hey, you need to go see a urologist. Do not go see your primary care doctor. They're going to waste your freaking time. Go see a urologist here, or go see an endocrinologist here, or go see hematology here. If they're a good functional practitioner, they're going to be able to not only tell you where to go, but they're going to be able to tell you when to go do it. And they're not going to have the pride that says, no, just stay with me and blah, blah, blah. No, you're probably going to stay with me while you do that. I'm not saying go there and leave me. What I'm saying is, hey, we need that while I fix all of this other stuff as well. So number one, be that practitioner if you're a coach. And if you don't know how to do it, you need my mentorship. You need my university. But number two, if you're a client or a layperson, find somebody who is going to care for you in that type of way, into that capacity. And understand that we're not here to say functional against conventional and conventional against functional. It's time for people to learn their place. I know my place. And I just think that if we would stay in our own lane, I think that this world would be a much better place. So find your lane, understand it's not throwing the baby out with the bathwater, it's chewing the meat and spitting out the bones. And if you can really do that as a practitioner, you're going to find a lot of success. you're going to be very successful. It's understanding that the conventional path has gone before us in a lot of ways. They just weren't able to finish the job. But maybe that's not their role. Just like the functional space did not lay the foundations for all this groundwork that we have. The conventional space did, if we're being honest. So I don't think that one could do super, super well without the other. I think conventionally it's like, hey, thank you for all the studies that you've done. Thank you for all the literatures that you've come out with. Thank you for all the statistics that we have. Now let me come in and actually fix the root cause of that and reverse those issues and therefore prevent them from happening again that y'all could not do. So both sides really bring pivotal concepts. And like I said too, if there's a liver failure or somebody, God forbid, has a blood clot, like if I see their right ankle swell, that's either varicose veins or a blood clot, but it's a blood clot until proven otherwise, right? From a safety perspective, you rule out worst case scenario first. If it's a blood clot and that thing goes up to their heart and they need to, or in their lungs or whatever, they need a D-dimer test to really be able to tell where that's at and whatnot. Don't come to me for that. Thank God for the medical field. Thank God for an emergency room. So I can send them there. But me as a functional practitioner, I've had clients have that. So what do? They text me and they tell me, hey, Nick, and they send me a picture. And I look at it and I go, hey, that's either this or this. We need to rule out this just in case. Go here, ask for this test, get this done now. And then come back to me so that we can prevent this from happening again. So notice it's being a good functional practitioner in all these areas. So be a good coach. If you're not like that, then you need to get raised up as that. And then as a layperson, find a good functional practitioner that views things in this way. So I hope this helps. Thank you so much for tuning in. Stay tuned for the next episode.